Ladies and gentlemen, tonight's match in this corner with a whopping triglyceride count of over 2,000, with normal at 150, is Familial Chylomicronemia Syndrome. And his opponent, undefeated and recent FDA approval November 2025 in all of these 50 United States, is Arrowhead's Redemplo!
First, let's hear Redemplo's backstory. Redemplo is one of those newfangled siRNA therapies. They're a rare breed right now, with less than 10 approved so far. But mark my words, you will be hearing more about these prize disease fighters. Let's hear from our ringside reporter for more.
It all started in 2018 with the very first RNAi Patron by powerhouse BioTech Pharmaceuticals. What's that, boy? You haven't heard of the company Alnylam? Well, perhaps you need to check in more with BioTech Swimmer. As any young disease fighter knows, siRNA gives a massive uppercut by stopping messenger RNA from turning DNA into proteins. So, if you want to stop the right proteins, then you can cure diseases like Arrowhead just did with Redemplo. Well, rumor has it that in their Palisade Clinical 3 trial, they were able to reduce triglycerides by nearly 80% compared to the wimpy 17% from placebo arm. Before treatment, median triglycerides went from 2,044 to 433 after treatment, which is massively impressive. With this 1-2 jab, acute pancreatitis was left stumbling and reduced risk of pancreatitis by 83%. Let's be clear, if I was a disease right now that could be cured by reducing production of a specific protein, I would be running to the hills because RNAi is a force to be reckoned with.